thanks for joining us tonight, everyone. Tonight we're going to be talking about natural approaches to hormonal imbalance. And joining me tonight, this is Barbara Lagoni, and joining me tonight is Dr. Steve Cheney, Professor of Emeritus of Biochemistry at the Medical School of the University of North Carolina, Hannah Sharapan, who has been doing nutritional consulting for 30-some years, Cheryl Mangan and Beth Kanyuk, who are our guests tonight, are going to share their stories of how what happened with them and how natural approaches to hormonal imbalances that they experienced was really helpful, and how they got to the other side of that. So let's get started, and we'll go to our first slide, which starts with a quote
Kylie's on, Barb.
Okay, I'll catch her in just a second. Thank you, Hannah. It starts with a quote from Dr. Margaret Christensen, who is a gynecologist and obstetrician and specializes in women's health issues. And she said on one of our webinars with her, she said that most women's health issues are caused from hormonal imbalance and estrogen dominance. So tonight we're going to focus primarily on the role of those hormones and with estrogen in particular, but we want to at least acknowledge that there is a very complex hormonal system that goes on in the human body that's far more complicated than just an estrogen, progesterone. There are many other hormones, many other glands, and they all interact. And so here's a very simple list of 10 signs of hormonal imbalance, but I will tell you there are lists and lists and lists of other symptoms from hormonal imbalance. These are just some of the basic ones. So it can start with, serious fatigue and mood swings and irritability, because we have hormonal receptors in our brains and estrogen receptors in our brains, and it affects serotonin levels. Weight gain and muscle loss affects hormones. Brain fog and insomnia, sex drive, acne, aching joints, night sweats, depression. And then there's all the symptoms you see when they're around estrogen, the deficiency symptoms and the excess estrogen, and progesterone deficiency symptoms and excess progesterone, and androgens and DHEA and testosterone. All of these symptoms, when they're too high or too low, even cortisol in the adrenal glands. So many of the health issues that people experience are related to hormonal imbalance. Let's look at estrogen in particular. When estrogen's too high, just look at some of these symptoms, from breast tenderness to bloating and volatile emotions. I love that. Pounding headaches, weight gain, yeast infections, depression, uterine fibroids, joint pain, water retention, irritability, blood sugar levels. These are all very commonly associated with PMS. And then you flip over to sort of the menopausal side, when estrogen tends to be getting too low, and it's hot flashes and night sweats and insomnia and mental fogginess and decreased sex drive and vaginal dryness and depression, fatigue, frequent urination, migraine headaches, memory, dry skin. I mean, it's just a lovely list there, and you understand why these hormones, which the body uses in teeny tiny amounts, but they really affect so many of the symptoms that we experience and so many of the systems in the body. And so we've, Dr. Cheney is with us tonight to walk us through some of the biochemistry of some of this. And Steve, maybe we start by talking about when people experience any of those symptoms we just walked through. The medical approach is often to prescribe hormonal medications. You want to talk about that?
Well, yes. This is the typical medical approach. You can't hear me? Can you hear me now?
Yes.
A little louder would be great.
Okay. But the typical medical approach is to, take a magic pill, something very simple that's going to take care of the problem. But as you mentioned just a minute ago, and we'll see in some of these slides here, the hormones are far too complicated, they interact in far too many ways for a very simple approach to be effective. So if you think about hormone replacement therapy, which was, one time thought to be a miracle pill. This was going to make your menopausal symptoms go away. It was going to protect your bones. Hot flashes, all of that sort of stuff would disappear. And yes, some of those symptoms were taken care of, but the risk was significant. Increased risk of cancer, breast cancer, endometrial cancer. I think I mentioned in one of our earliest calls that the single most effective intervention at decreasing the incidence of breast cancer was when they stopped recommending hormone replacement therapy to all menopausal women.
Oh, my goodness.
That was the single most effective therapy. Increased blood clotting, which can lead to heart attack and stroke, gallbladder disease, and then birth control pills. Obviously, there are great reasons for using them, but again, it is a simple hormonal approach, and it can lead to depression, migraines, blood clots, liver damage, breast lumps, all sorts of side effects. So again, the simple approaches aren't always the best. So if we go on to the next slide, that's because it's complicated. So if we just look at a normal menstrual cycle, estrogen and progesterone balance one another. And, what happens is typically the estrogen levels go up first. And, that's where if that is too excessive or too long, that's where you get PMS. And then eventually the body balances that out by producing more progesterone. But I guess, Barbara, I'm a guy talking about a woman's issue here. As a woman, speak to what happens when those estrogen levels are high and the progesterone hasn't kicked in yet.
Mm-hmm. And that's when the PMS symptoms will kick in, and these hormones are made out of nutrients as well, so they're very important. But notice how they work together. When the estrogen goes up in order to trigger ovulation, and then, thank heavens, the progesterone kicks in that, and it helps push the estrogen back down. So let's look at the next one, Steve.
Okay. So, one of the things I think that a point that many people miss is that we don't have any organ or system in our body that is an island unto itself. They all interact. So we think about we've got a hormonal problem, but that could have originated in the gut. If you have candida, which is yeast overgrowth or bad bacteria, and now you've got a leaky gut syndrome, or maybe it's a food allergy, something like a gluten intolerance. Again, that can lead to a leaky gut syndrome. And now you start to create inflammation, and that starts to affect hormone levels. It could be a bad diet. It could originate from inflammation, where which can be caused by obesity, high-fat diets, infection, lots of things. Or it could start in the brain. Things like stress, anxiety, depression, lack of sleep can cause these hormonal imbalances or cause inflammation. And it also, you see, all of those arrows go both ways. If you have a hormone imbalance, it can affect your intestine, your digestion. It can affect your brain. It can affect inflammation. So, it's not just a simple thing. So if we look at the next slide, go back to estrogen dominance. Now, a minute ago, Barbara gave you the symptoms of elevated estrogen levels. But again, if you think about how all the systems in the body interact, what causes that estrogen dominance? Well, it could be stress. It could be there's elevated cortisol levels. It could be diet. Maybe it's too much sugar, too much, especially refined sugars. But it could be other nutritional factors such as obesity. So we're talking about excessive calorie intake there. Liver function. It could be deficiencies. It could be environmental. You could be, there's a lot of estrogen that's used just for the purpose of speeding up the rate at which animals gain weight. So, a lot of the meats that we eat have estrogens or estrogen metabolites in them. There is what they call the xenoestrogens. Now, those are things like you've heard the term in certain pesticides and that sort of thing, where they're endocrine disruptors. And that's what they're talking about. They're affecting the estrogen response in the body. They're hormones in milk, they're the herbicides, pesticides, all of those things. And then there's the doctor cause, the birth control pills, the conventional estrogen replacement therapy, hormone replacement therapy. These can all lead to estrogen dominance. So the next slide, it makes another very, very simple point. So this is a circle. So if we follow those arrows around, if you have estrogen dominance, and it could be caused by any of those things we talked about a minute ago, that's going to make you retain fat, particularly belly fat. So that helps to drive obesity. But by the way, obesity drives the estrogen dominance, and that's because fat tissue produces estrogen. So it's not just our ovaries that produce estrogen, it's fat tissue. So once you become obese, that gives you estrogen dominance, it leads to hormone imbalance, and then it becomes a vicious cycle, because that estrogen dominance is going to predispose you to even more weight gain. So we move on to the next one. And we also need to remember that all of our hormones interact. So when we talk about cortisol, the stress response, that's one of the things that the adrenal gland does. That can affect our pancreas. It can affect our blood sugar levels because it affects the insulin response. It can affect the thyroid hormone levels, which affects metabolic rate. It can affect the ovaries, the testes, which affect estrogen, testosterone, progesterone. But remember, all of those arrows point both ways. So the estrogen dominance, it can also affect all of these other hormones. Or if you become diabetic and now your insulin levels are out of whack, that can affect those other hormones as well. Our body is a very complex system.
And fascinating too. I mean, nature has really created a really interesting system that is in perfect balance when we feed the body all the foods that nature intended. And you can see when we start getting out of balance with our diet, with our nutrients, so that the cells of these various glands and organs can't function properly, you start having a hormonal imbalance in one arena, and you can see how it begins to affect the entire body. That's why when you look at that list of the symptoms of hormonal imbalance, it like affects all the different parts of the body. This is why. That's what we wanted you to see.
Let's just look at thyroid as one of those examples, because there are people always asking us, well, Doshekli is a supplement that will help the thyroid gland. And the simple answer is no. If you've got a thyroid deficiency, there's no magic bullet that's going to affect that. But we remember, if you go back a few slides ago, the health of our intestine, the health of our brain, the inflammation, all of these things affect our hormone levels. And by the way, all our hormones are interrelated. So when we improve the health of the body, and we improve the health of our hormones and system, when we get our hormones back in balance, sometimes these thyroid problems can get better. Let's move to the next one. So let's talk a little bit about our adrenals, because they really do a lot of things. They produce aldosterone, that's in the lower left corner there, and that maintains fluid balance. So, if you're starting to retain water, that's because your fluids, your aldosterone levels are out of balance. Cortisol is our stress hormone. That helps us to handle stress, but again, it can be very damaging if it's always elevated. And the DHA pathway, that's important for health and reproduction. As you've got your testosterone, your estrogen in there. The estradiol is your estrogen. So it's not important there, but it's also important for health. So if you think about What do you know about estrogen? We know that estrogen is important for maintaining bone density, which is one of the reasons why bone density becomes such a concern after menopause. Estrogen is also important for heart health, which is why women have such low risk of heart disease until they get into their 50s and they start to go through menopause. Then in just a few years, they catch up and surpass men because they no longer have the protective effects of estrogen. So all of these things are interrelated. And if you think about it, if you have a lot of stress, and now you're pushing more of these precursors to the cortisol pathway, you've got less there. You got less left for estrogen and for maybe aldosterone. So you start to get things out of balance. If you have the estrogen dominance we've talked about a minute ago, so you're pushing everything through that pathway, that affects your ability to handle stress. And again, it may affect your aldosterone levels. So maybe you could start to get fluid retention and that sort of thing. So again, if we just think of the adrenal glands themselves, that's tremendously complicated.
And Steve, we might even mention that it all begins up here with cholesterol, and this is why you want to be even careful about cholesterol medications, because you don't want cholesterol to be too low, because it's the beginning of all of these hormonal production cycles. Okay.
You need a certain amount of cholesterol. That is sometimes missed in the conversation.
Yeah. It's
so
like
Go ahead.
Okay, well, so just to look at the adrenal glands.
Go ahead.
It's okay. Just to look at the adrenal glands a little bit more closely. So we've talked about adrenal glands, and ovaries are producing the estrogen and progesterone. We've got up in your brain, you got the pituitary gland and the pineal gland. There's a whole bunch of them. The adrenal glands are really important, and they're the ones who are majorly affected by stress. And this is an interesting slide about look at all the things that are so real in people's lives, all the different stress factors, financial and psychological and emotional and negative attitudes and beliefs and fear and all of this stuff. That stress from the chart you just saw above, that's why it affects these poor adrenal glands. Lifestyle options, not only smoking, but just lack of sleep. We know that is a serious issue for Americans. Diet, when we, so many people need coffee in the morning just to get a kickstart to the day. They rely on coffee and sugar. They're addicted to refined foods, and it just wears out these poor adrenal glands. Even when we have infections and allergies and so forth, those all put a stress on the adrenal glands, and so it leads to the symptoms of adrenal exhaustion, which is very common. Difficulty getting up in the morning, never feeling well rested even after sleeping, nocturnal waking, getting up in the night and then can't get to sleep, anxiety, nervousness, mild depression. The last statistic I saw was 1 out of every 10 Americans is on an antidepressant, lightheadedness when you stand up, low blood pressure, salt cravings or sugar cravings, and caffeine to kind of give us a kickstart, problems coping with stressful situations, frequently getting angry and just not in control of our emotions, struggling to get through the day, frequent infections, abdominal weight gain. And if you think you have stress to start with, and then you take these things and it puts more weight on you, poor things, they get even more stress. Hair loss, acne, cold intolerance, lack of mental focus. These are very real symptoms in today's world. And so what we want to do now is we want to give you a little background so you can understand where hormonal imbalance comes from, and then offer some natural approaches that might be a logical first step before we reach for medications and pharmaceutical remedies. And so we have invited some folks to join us to share their stories, and we're going to start with Cheryl Mangan, who is at a family reunion somewhere in a very remote location in Indiana. So we're going to attempt to hear her. Cheryl?
I'm here. Can you hear me?
Hallelujah. Yes, we can. Okay.
Yes.
Share your story with us.
Okay. So anyway, when I was introduced to Shackley, well, first let me back up. When I hit my late 30s, I was an ultrasonographer working full-time, and I had two preteen boys, and I began to have some premenopausal symptoms. I had a lot of doctors in my ultrasound room, so I was always asking them, what should I do? I'm having night sweats, or I'm having headaches, or I can't sleep, or I have breast tenderness, or mood swings, and you name it, I had it. I think that I had every one of those symptoms that were on the slides that Steve was showing. But anyway, every doctor kept recommending just, hormone replacement or antidepressant or something for the anxiety, and I really did not want to. I have a strong family history of cancer. I come from, I'm one of 7, and 4 of the 7 have had cancer, so I really thought that wasn't a good option for me. So anyway, I kind of put it off and just kept thinking, I'll feel better. But by the time I hit 41, my parents had both become sick. The boys were at that fun age. One was 14, the other one was 11, and they were a handful. I was working full time, going to school on my day off, and then we got a puppy. I think the puppy was what broke the camel's back. The true tipping point. Huh?
That was it. That was it. Yeah.
But I began to seek out other doctors. I went to osteopathics. I went to MDs. I went to female doctors, and everybody ran a bunch of tests, and they said, everything looks good. Your hormones are good. Your thyroid looks good, and your cholesterol is good. They couldn't find anything wrong with me, and yet I knew that if I continued on this pathway, I would really feel. 5 more years, I didn't know how I would feel. So that's when a friend of mine was a psychologist, and I asked him, and he started asking me about the stress in my life and how I ate and things like that. And he referred me to my upline in Shackley, and it was even after working in healthcare for 20 years, I don't think I ever thought down to the basics of what makes your hormones, because when the person presented to me and told me that, if I would try these basic nutrients, that it would make such a huge difference, I really didn't believe her. I just thought, I could tell you where all your organs are and what everything does, and I knew something was wrong, but I couldn't, I didn't think that it was as simple as taking supplements. But I would say within the first 3 days of taking the shakes and the multi and B complex and vitamin C, that my symptoms began to disappear. My headaches, I would have daily headaches where I had a bottle of Advil in my desk, and it was the first time probably in 2 years I didn't have a headache. I began to sleep, and it was just a complete turnaround.
And how long a time?
Within 3 days, I noticed a difference.
Oh my gosh! Okay.
And then within my first cycle, my mood swings began to disappear, and my cycles got back to normal, where the bleeding went back to like 3 days, like it was supposed to be, which hadn't been that way for years. So it's just
excellent. And so, tell us what you took then, Cheryl, because I know then we didn't have all the products we have today, but if we were to translate to what today is, what would be like the basic things you started on?
When I first started, what today we have, it would be like taking Vitalizer and one of the proteins, either 180 or the energizing protein.
So soy proteins, okay.
Right. And menopause balance complex and GLA. And probably extra B, because when I started, I actually started taking 4B a day, along with, the multi and the C. and 2 shakes a day. And I think part of the issue was my blood sugar was so out of whack. I think it was real protein deficient, and that was causing all kinds of other problems too.
Yeah, and that what Steve's slide shows is they're all interrelated, and so when you start putting the nutrients back in, it's amazing how quickly the body responds. Thank you, Cheryl. Very
You're
good.
welcome.
Thanks. Okay, so
glad.
Then Hannah, if you would talk to us a bit about, you have a customer, Megan. Tell us about her situation.
Well, actually, she isn't mine, but she's a friend of ours, and I think it's really an exciting story, and she has a Monday night commitment, so she couldn't be with us personally, but was considerate enough to write this out for us for me to present it to you. She was diagnosed with fibromyalgia when she was only 13 years old, and that was confirmed by 3 different physicians, by the way. And so at 27 is when she first found about Shaklee products, and she had such a complete reversal that within 3 to 6 months, she was really basically free of her fibromyalgia symptoms. And after a year on Shaklee, she decided, well, if it's worked for all of this, maybe I should go off my birth control pills, because she had a history of PCOS, polycystic ovarian syndrome, and she felt maybe it was related to fibromyalgia, but whatever it was, she had been put on birth control at 18 to try and help with it, and still had to have laparoscopic surgery for cysts in the past. And then the one time she did try to go off the birth control pills when she was 24, she landed in the emergency room with a cyst before you knew it. So she decided that as she was learning what different Shaklee products did, that she should add just even 2 GLA a day to everything else she was taking, and she went off the birth control pills. Her cycles regulated within just a few months. She hasn't had any cysts since. It did increase her PMS symptoms initially, though, and she did start even experiencing some pretty bad acne after going off the birth control, because, that certainly helps control that, even though it has the side effects. So now that she's been off the birth control for 2 years and having no cysts, regular cycles, she decided if it did all of that, maybe if she added a 3rd GLA a day, and this was just a couple months ago, that if she did that, maybe her skin would clear, and it has. And she's also noticing a lot less cravings for dark chocolate, which is her major vice in life, and it also has greatly reduced her PMS. So she said it could be a fluke, but her chronic eye dryness has also improved, which I don't think
I
is a
definitely
fluke at
noticed
all.
that. Yeah, I had that, and the GLA absolutely helped that. One of the things I was reading about when people are given birth control pills, which is an estrogen prescription, that it so taxes the liver to have to try to take it, detoxify it and take it apart and get rid of it, because it's too much overload on the liver. And so when somebody comes off of medications that they've been on for years like that, it takes a while sometimes for the body to adjust, because one of the other side effects of, it's that old, if you don't use it, you'll lose it, is sometimes it suppresses the production that the normal glands and organs should be producing of these hormones, and so it takes a little while till those glands and organs can kick back in and begin production themselves. So that's
in fact, I was thinking, as Cheryl was giving her testimony, and it's wonderful she had the results that quickly, but if somebody is out there and is going to do this program and hasn't gotten the results that quickly, don't give up, because it does take different lengths of time for people to have the results. But generally speaking, the people stay on a good nutrition program are very, very pleased with the results they get.
Very good. Thanks. Well, we'll be back to you in a minute. You've got another story, but let's go to Beth now, because she also had polycystic ovarian syndrome. And Beth, you have a very interesting story. Would you share that with us?
I would love to. It's hard to even figure out where to start. So I did a year of fertility treatment to try and get pregnant with and I finally, sorry, I am like not there. I did a year, so I did Clomid for my first few rounds, and I was not even close to ovulating. And then we did shots, and I overstimmed my first 2 times. I had about 12 eggs, each one. And then my next one was a viable cycle, and we tried, and it didn't happen. And then the next round, I ended up getting pregnant with my twin boys. The pregnancy was a little bit difficult, as it is with most twin pregnancies. I gained a lot of weight. I gained about 65 pounds.
65?
Yeah, 65 on my, and I'm 5'4", not very big.
Oh gosh.
Yeah, I was in the 200s, and that's not very.
That's hard on your body. Yeah.
Oh yeah. And if you saw me, you'd be shocked at a 200-pound weight. So, it was about 20 pounds of swelling my final week before I delivered the boys at 33 weeks. So, yeah. So it was not an easy pregnancy. I was pretty stressed out. I was not eating great. I've realized that with polycystic ovarian disease, you tend to crave carbs a lot, and I was eating carbs all the time, thinking I was eating fairly healthy, but I wasn't, because I was eating a lot of low-calorie things that seemed healthy to me, but they were not. And to mention, too, my husband did have a lower sperm count as well, so that's why we did IUI for my fertility. So once my boys were about 8 months old, my friend introduced me to Shaklee, and the cleaner seemed like a no-brainer to me. It was kind of, you save money. Why wouldn't you do it? And my boys were starting to crawl right around then, and so I didn't want them picking up anything on the floor. I was using vinegar, and she explained to me how that doesn't really clean as well as you think. So I made the change, and my husband and I both are on Vitalizer as well. And we loved it. It's amazing. We're still taking it to this day. And then when my boys were 13 months old, I came home from the store grabbing a pregnancy test because I was not feeling very great, and shocked to see that I was pregnant.
Oh my gosh. So you had to go through all the fertility treatment, and then you'd been on Vitalizer then what, just 4 months?
Yeah, 4 months, and I was drinking an energizing soy shake a day. That was my snack since I was still nursing my boys. And became pregnant. So I don't know what happened. Well, Shaklee helped my husband's sperm count as well as helping me ovulate. So that was pretty crazy. And then my pregnancy was so much better with my singleton. And I know it's kind of not comparing apples to apples since it's 2 versus 1, but I still had to chase around my crazy boys all around, and I had, I added 180 shakes and B-complex, and I was able to chase after them and keep up with them. We went out every single day because I was in California and we didn't have a backyard. So it was very difficult trying to keep them contained in a small area. And my energy levels were crazy and they were great. I found myself not craving really bad things. I only gained about 23 pounds, I think it was.
Oh my goodness.
I don't know why my phone keeps
as compared to 65?
Yeah, exactly. My doctors were, as I was in the room, my doctors actually were shocked to see the difference. They were like, oh my gosh, I thought you were 200 pounds there and now only, 165 or whatever it was, and they were impressed. So, and it was just such a better pregnancy. I was a lot less stressed. I just felt better.
And you have a customer, is it, who also had some issues?
Yes, yeah. So I had someone come to me, and she said they've been trying to get pregnant for about 6 months, and she has 2 little girls, I think about 6 and 4. And she had miscarried a few times, and her husband was actually deploying in about a month.
So
Yeah.
maybe we should mention that both of you have military
Yes.
families, which means
Yes.
sometimes your husbands disappear and you're suddenly single parents
Exactly. Yep.
with 3 kids under the age of 2. Okay, go ahead.
Exactly. Yeah, and she had come to me and she had asked, if there's anything she could do, and she was already using the cleaning products, which she loved. So I told her, I was like, let's try. Oh, and her cycles were off too. Her cycles were some days they were 30-something days, some days they were 50 days. So they were really, really off. So I was like, let's take a chance and let's put you on Vitalizer and GLA and let's see what happens. And she was tracking her ovulation and she got pregnant right before he deployed.
Oh, fabulous. That is fabulous.
Yeah.
Sometimes the body can respond really quickly. Oh,
yeah, it was amazing.
Thank you.
It is.
Oh, excellent, Beth. And no more of the polycystic ovarian syndrome, no leg cramps, that you're just back to a good, healthy place.
Yeah, and that was the other thing too, is I lost the weight so much quicker with Logan, my recent, versus the twins. The twins took me about a year, maybe a little over, and at Christmas I was wearing, which was 2 weeks after Logan was born, I was wearing my pre-pregnancy pants, using 180 and everything else. So
just a couple months then.
Yeah, not too long.
Good. Excellent. Okay, and then Hannah, if you could just quickly tell us about Joanne,
right.
The uterine fibroids, yeah.
Well, first off, as you were telling your story just now, it dawned on me something else that happened with Joanne even before this, and that is that she kept having trouble getting tubal pregnancies, and they had to remove a tube, and the other tube, they told her, was so damaged they didn't think she would ever have children. And by this point, she was on Shackley, and she did have a daughter. So I forgot about that part, which is so important.
That's a big one, yeah, right.
That's a big one. Well, anyhow,
so
then she started to develop.
Okay.
Yeah. And then she started to develop these uterine fibroids, and the doctors had recommended a hysterectomy, really, because she was having so much difficulty. She'd have terrible pain, and then that would last before, during, and after her period. So after the first month on these products, in this program, I should say, because she had already been on some supplements, but as we increased that, she had no pain, and after 3 months, the fibroids were gone. And the doctor said, well, I don't know, maybe we should attribute this to the supplements, but I don't know. But, of course, we all knew. Mm-hmm. And so the Vitalizer really contains a great deal of what she took at the time. However, we didn't have those products then, and so she did take them separately and in fairly large amounts. But one of the beauties of this is sometimes people get such great results with the Vitalizer and with just the other products that we mentioned here, that's okay, to begin there. And then perhaps if that doesn't do it all, then maybe the certain supplements should be increased, like the GLA and like the B complex, for instance, as an example.
And so we keep seeing with each of these stories these same products that seem to really help folks: the Vitalizer, the GLA, B complex, and the soy proteins. We just see those repeatedly. And then she was also on the calcium, which is the osteomatrix. Yeah. Oh, excellent.
Absolutely.
Okay. And after you told about her, I did quickly mention Marilyn Garapolo, who when she was 49, she had real serious heavy bleeding, and she was diagnosed with uterine fibroids that were the size of grapefruits. And they wanted to do a hysterectomy, and she instead went to a naturopath who tested her for candida yeast overgrowth. And so she had a ton of it. It was like a 90% of her body. Her ears were itchy, her toes were itchy and peeling and all that stuff. And so they took her off of all sugar and refined carbs. She, put fresh vegetables into her diet. And I don't remember, it was 8 or 9 months later, the fibroids had shrunk, and she lost 20 pounds in the process, which is even better, so all the news was good. Cheryl, I unmuted you again. Are you still there?
Yes, I am still here.
Because Sandy and Eileen were your folks, right?
Yes, they were good friends of mine.
Yeah, quickly tell us about their
Sure. With Sandy, she was beginning to have night sweats and hot flashes, and she wasn't sleeping well at night. And I think she had just turned 50, but we started her on Vitalizer with iron and the Menopause Balance Complex and the 180 shakes. And within the first month, she started to feel so much better. But she had some other protein shakes, and she said, next time just get me one smoothie, and I want to finish this up. Well, it wasn't but a couple weeks into that second month, and she called me and she said, no, send me the 180, that her symptoms had begun to come back already when she switched to the other protein. So that was Sandy, and she was having heavy bleeding and all kinds of issues, but they went, she's doing great, and now it's been about 8 months, and she's just doing fantastic.
And we may want to mention, while we're talking about the soy that Shackley uses, it's not only non-GMO, but it's the way they process it that maintains the highest level of those isoflavones, which are the really significant part of the soy that benefits balancing estrogen and the hormones. So that's probably why it was more effective. Great. And then what about Eileen?
And Eileen, she had talked to me about a year ago, and she had gotten started on a great regimen. She had the Multi and the B and the GLA and the same products we were talking about, and she'd been doing very well. And then she was scheduled for some minor surgery, and her doctor told her to stop all of her vitamins for 3 days. So she stopped them all, and I talked to her after the third day, and she began to have her hot flashes were coming back, and she was starting to have trouble sleeping again, just from being off for 3 days. So,
and there's that same regimen again. Wow. Yep. Okay, it's good. And then Kylie, are you there? I didn't get to test your audio before.
Yes, I'm here.
Can you talk as loud as you can, so make sure they can hear you? Good. Okay. And so you had a friend, Andrea. What happened with her?
Yeah, Andrea is a really good friend of mine. We were actually on vacation about a year ago because it was Labor Day, and she came to me probably the second morning we were there, and she had a huge gash on her nose, and she told me that she had gotten up to use the restroom in the middle of the night, and she had fainted, and she hit her nose on the toilet on the way down. Oh. And so we talked a little bit about it and thought of some possibilities of what it could be. And she came back home from vacation, and it happened again. And I believe at that point she went to the doctor and found out that her iron was really low. And so I started her on iron with C and Vitalia at that point. Mm-hmm. And so her fainting spells stopped. But at that point, she had no idea that the other symptoms that she had were contributing to her fainting. So she didn't think it was necessary to tell me, but she was also having, I think it's called breakthrough bleeding, where she was having a 7-day period, and then it would stop for about 2 or 3 days, and then she would start bleeding again pretty heavily, kind of like the first couple of days of a period. For another 3 or 4 days. So she would have, I think, 11 days of bleeding or something crazy like that.
No wonder she was getting anemic. Mm-hmm.
Yeah.
Oh, right.
Mm-hmm.
Yeah.
Because the ideal period, in case, I think Cheryl mentioned it earlier, is 3 days.
Mm-hmm.
Yeah, it's good.
She went to her doctor, and her doctor was not very thorough in her mind, and so she came to me and she said, this is what my doctor told me. He either wants me to be on birth control indefinitely or to have a hysterectomy. And she's only 33 years old. So she was not willing to really do either one of those things. She had a pretty good diet, probably not nearly enough protein, and she would admit that. But we started her on Vitalizer and GLA, just one a day. Her budget was so that she couldn't really afford to do more than that, and this was actually a stretch for her, but she thought it was so important that she wanted to spend the money on the Vitalizer instead of just the Vitalia. So she started 9 days before her cycle was supposed to come back, and that cycle that she started 9 days after was a normal cycle, her first normal cycle in over a year.
Oh.
So, and this was maybe I want to say 5 months ago, and she hasn't had any of the heavy bleeding.
And it's been back to normal since. Oh my gosh. Wow. All right. Well, so there they are. Those same products keep showing up. So when somebody wants to begin to work on balancing hormones, the first step always is just begin working on the diet. And I'll tell you what, the changing the diet is usually the hard part. Taking the vitamins is easy, but we just get into these habits of, especially around the carbs. They now say that where we get addicted to sugar and carbs and wheat in our brain is the same place we get addicted to cocaine and to opiates. That's how powerful the addiction is. But what we want to do is begin eating the foods that nature gave us, that nature intended to grow out of the earth, especially vegetables. 6 to 9 a day is a great starting place. And then here are the supplements you keep hearing everybody mentioning. Individually, that this Vitalizer strip is a daily vitamin strip with 6 tablets on it. And here are many of the products that people mentioned that are right in that Vitalizer strip. And then to that, the soy protein, very important for repairing and balancing hormones, both in several different products that are energizing soy protein shakes and the Shaklee 180 smoothies and bars. And then GLA, that's one that everybody notices an improvement with. Menopause Balance Complex, especially if the issue is estrogen that's too low, and then liver DTX. So let's just tick through these real fast. Professor, you want to mention something about the Optiflora, because that relates to what you were talking about in the gut before.
Yeah, so Optiflora is, of course, a component of Vitalizer. But why it's so important? Because remember when we had that slide where we talked about the health of the gut, the health of the intestine is very important. We don't want to have a leaky gut because that can cause inflammation. It can cause a lot of these problems. And when we have yeast or bad bacteria residing in our gut, that can cause the leaky gut syndrome. So what we really want to do is we want to replace it with friendly bacteria. And the Optiflora is ideally designed because it protects those bacteria from stomach acids and oxygen until it gets to the lower intestine where those bacteria can take up residence. So you get 90% delivery. And that's really important. So that's the first step, and that's part of the Vitalizer.
And then comes B complex, which could be my most favorite one of all. I always say it turns every woman into Mother Teresa because it's essential for the brain and the nervous system. So people with mood swings, irritability, nervousness, mental confusion, depression, dizziness, trembling, all often associated around PMS, though people just notice a difference almost immediately. And then cravings for the sweets. B vitamins are depleted by sugar and alcohol, caffeine, refined carbs, medications, and stress. In other words, most everybody's life. And Bs are only in like dark green leafy things and some whole grains, which we want to be kind of moving away from the grains a bit. And so they're water soluble. They have to be replaced all the time. But boy, are they beneficial for helping to balance hormones. And that's why you've heard all these wonderful stories, and we thank all our guests that shared, from PMS and morning sickness, prevention of birth defects, cervical dysplasia, hormonal imbalances of all kinds. B vitamins are just fabulous. And then it helps regulate blood sugar. And you saw from Steve's slide how blood sugar all is connected to our hormonal health as well, and helpful for the heart and our blood vessels and insomnia and hair loss and so on. B vitamins are really important. There's the Vitalizer. Steve, you want to talk about that?
Sure. And we talked about the Optiflora, the B vitamins, the vitamin E, vitamin C, beta carotene. Those are just some of the 80 nutrients you find in every one of those Vitalizer strips. So it really is a comprehensive start. We go to the next slide. This is the landmark study. This is the proof that these products change people's lives. It was a study that Dr. Gladys Block at UC Berkeley did in 2007. And she looked at people who used the Shaklee products for 20 years or more. Those were the blue bars. Those were the green bars. They looked at people who used no supplements. Those were the blue bars. And people who used other companies' multivitamins. Those are the red bars. And if you look at disease outcomes, the risk of congestive heart failure and heart attacks was 3-fold lower in the Shaklee group. And the risk of diabetes, the incidence of diabetes, was 4-fold lower. And these groups were matched with age, with weight, with gender, with ethnicity. The only difference was in the supplements they were using. So, yes, we've talked about some amazing results that people have gotten with the Vitalizer in terms of hormone imbalance. But, that's just the short-term benefits. The long-term health benefits are huge.
Very good. And then the issues around soy protein.
And Barb, you did a great job of talking about the benefits of the soy protein, particularly Shaklee soy protein, which, as you mentioned, is not only non-GMO, but it's processed in such a way that you maximize those isoflavones, which really help with the hormonal balance. But then you have all these fears. This has been, there's some of these things that have been repeated so often on the internet, they've become generally accepted as true. They've become what I call urban myths. And that's one of them is really the soy and breast cancer. That there was a sort of a kernel of truth in all of these myths that you find in the internet. And the kernel of truth was there were some animal studies which suggested that soy protein might increase the risk of breast cancer. Now, those were mixed because there were other animal studies that came to exact opposite conclusions. But you know what happens when scientists have something like this, where there are studies that say that could be a problem? And they're based on animal studies or test tube studies. We go out and we do clinical studies, that is, studies with real people. And those studies show that consumption of soy reduces the risk of developing breast cancer. But even more dramatic is if you already have breast cancer. So you do a click here. Okay? So basically, there was a study published in 2009 that there was a very robust study. There were 5,000 subjects who had already had breast cancer. They were breast cancer survivors. And what they found is the ones with the highest soy intake had a 25% less chance of breast cancer recurrence and also a 25% less chance of dying from breast cancer. And, you might say that's a single study, but there have been 5 more studies that have been published since then. A couple of them showed no effect of soy in breast cancer risk. The other 3 showed decreased breast cancer risk for breast cancer survivors. None of them showed any increase in breast cancer risk.
Wow. Really impressive. So where do you begin? Well, we talked about a healthy diet and then the best breakfast on the planet. A wonderful place to start is with the Shaklee 180 smoothies and Vitalizer. Best breakfast on the planet, 80 nutrients that are, what Shaklee's really known for is absorption. And these 80 nutrients are in the, not only are they very well absorbed, but some nutrients are intended to be absorbed in the stomach and some in the lower intestine, some need to be released immediately, and so the Shaklee is just brilliant at that. And so when you take those, some are water soluble, some are fat soluble, they understand all of that and they are released accordingly. So that makes a wonderful starting place. And then you heard people talking about GLA, and GLA, gamma-linolenic acid, this is a really interesting omega-6 fatty acid. You often hear about omega-3 fatty acids and fish oil, and this is an omega-6. And these fatty acids block prostaglandins that cause inflammation and menstrual cramps and bloating and helps correct hormonal imbalance, but they're not just for women. GLA just does many beneficial things in the body, but since we're talking about hormonal imbalance, as you heard, almost every one of the stories we heard tonight, it was the GLA that also was really instrumental, reducing not only MS symptoms but hormonal headaches, menopausal symptoms, as well as I take it regularly because I found that it helped reduce dry eye syndrome, so that was kind of nice. And then there's Menopause Balance Complex that you've heard people again talking about tonight. This is black cohosh, you've probably heard of that, flaxseed extracts, dong quai, red clover, licorice, and also contains these isoflavones. It's a very, very nice product, and especially at menopause, women find that very beneficial. And then one of the products that we don't often talk about, and I realize it's really important, especially when we're talking about hormonal people on birth control pills or who are taking hormonal replacement therapy, is liver DTX complex. This is a product made of these very important herbs, milk thistle, schizandra extract, dandelion, reishi mushroom, turmeric, artichoke. The liver is the filtering organ for the blood. It manufactures all kinds of important things, among them hormones, but it also has a role in all kinds of digestive in the digestive system, produce protein synthesis. It's a gland that has a major role in metabolism, plasma protein synthesis. I mean, it's a manufacturing site for the body, and it takes a blast whenever there's a lot of toxins in the body, and that's why we've got to protect it. So, we understand there's a finite number of pills a person can swallow, but liver DTX is one that I would suggest you add 2, 3, 4 times a year, but especially if you've been on medications, and protect that liver and help to detoxify it gently and naturally. It does it by improving bile flow, and when more bile is flowing through the liver, it helps carry away those compounds that are being detoxified, helps repair and regenerate liver cells. There are so many stories I can tell you of people who had elevated liver enzymes because of having various health issues, and after being on liver DTX for several months, those liver enzymes begin to improve. It contains antioxidants and helps protect liver cells. People not only who are on medications and people who have liver conditions, but if you've had food poisoning, that's a real damage to the liver. Excessive alcohol consumption even reduces the risk of gallstones, and one book said it even helps lower cholesterol levels. So, Professor, you mentioned that part of the estrogen cycle is about increasing weight, and especially around the middle. That's why Shaklee 180 might be a good option.
Well, yes, and so we don't need to go into a great deal of detail here. If you remember that slide with the blue arrows, that was basically showing you that if you're overweight, that can lead to estrogen dominance, because those fat cells are making estrogen and pumping it out into the bloodstream. So because of that, if you're overweight, that Shaklee turnaround program can be a great way of getting your weight under control. And that's just one more thing you can do to bring your hormones back into balance.
Absolutely. And so there's our summary slide. As a great place to start, Vitalizer, the soy protein, GLA, always include those 3. And then I would strongly recommend, and I think most of our guests and I would recommend, Extra B complex. My friend Pam, who has 5 kids, she says take 1 for every kid you have. And then if you're at menopausal ages, if you're noticing the symptoms that have to do with reduction of estrogen, Menopause Balance Complex is fantastic. So with that program, I was thinking about that expression about when mama ain't happy, ain't nobody happy. And so here's to having happy, healthy mamas everywhere. Thanks for joining us, everyone. Let me just quickly check for questions and see if there's anything we need to field here real quick. Here's one. What do you recommend for a woman who is 61 years old and experiencing night sweats all of a sudden? Professor, you want to take that?
Well, I think I think that would be no different than what the women who were just a few years younger were experiencing. We talk about 50 as the magic age, but in reality, the symptoms of menopause can pop up at various times in different women. Sometimes it's earlier, sometimes it's later.
Mm-hmm.
So I think the approach would be the same.
That the same products would be just fine, and especially Menopause Balance Complex. And Suzanne told us that for our information that DTX is best taken at least 1 hour before eating or 2 hours after eating to optimize liver utilization of the DTX nutrients. So I think Rusty, our friend who is a pharmacist, told us that herbs are best taken away from meals. So that's just what you're talking about. So very good. Let me quickly see any other quick questions here. How can we help people who have had hysterectomies? You want to speak to that, Steve? How can we help women who have had hysterectomies?
Well, obviously, if you had a hysterectomy, you can't replace the role of the uterus in hormone production. So some hormone replacement therapy may be necessary, but we still need to do everything we can, all of those other things, so that we can minimize the amount of hormone replacement therapy we need and not let it throw us out of balance. Because, I think people sometimes have a mistaken impression. They think if the cause is a clear medical cause or a clear genetic cause, there's nothing you can do with diet. And so my question is, okay, so we've got a clear medical problem. There's going to be some medication required to take care of that. But if we do that in a body that's not getting the nutrients it needs, so everything else is out of balance, that just makes the problem worse.
Totally. Mm-hmm. Yes, totally. And I still remember Dr. Scala saying, who was a biochemist from Cornell, I remember him saying, I can't think of any condition of the body that wouldn't benefit from better nutrition. Mm-hmm. So it's always worth a try. Right. And then Claire was asking about GLA. How is GLA different from omega-6 as different from omega-6? So many, it keeps jumping here. Reports indicate that we get too many omega-6s from our American diet. You want to tackle that one, Professor?
Well,
GLA is an omega-6. Mm-hmm.
Well, it's not actually not just an omega-6. It's a gamma form, which that's just a chemical term which talks about where how that molecule is arranged, but it's not arranged exactly the same as the regular omega-6s. So it's really a class unto itself.
So omega-6s, they're often referring to vegetable oils.
Things like safflower oil, sunflower oil, the linoleic acid. See, this is gamma linoleic acid as opposed to just alpha linoleic acid.
Well, now there, you can impress your friends with that, Claire, to say, oh, it's because it's the gamma form of linoleic acid. Okay, thank you.
It's distinct. It makes a distinct form.
Thank you, Professor.
Into different effects.
That's very good. Anyway, thanks, everybody. And next week, the professor and I are going to be talking about nutritional support for cancer patients. So be sure and let folks know who that might be helpful for. Steve, as you know, has been a cancer researcher for how many years, Steve, did you run the lab?
Well, the Cancer Research Lab was about 30 of my 40 years at UNC.
Wow. So there's some things that we've learned that might be helpful that we're happy to pass along to folks. So see you next week. Thanks for joining us. Good night.